So welcome to tonight's Healthcare for All program. Thank you for joining us. We're going to discuss this moral revival that the Poor People's Campaign is bringing to us. So we're welcoming Ming Chen to help with the language of morality and that fight for universal health care. I'm Ronnie Shure, and I'm retired, but my volunteer job as your president almost feels like a full-time job. You too can volunteer for Healthcare for All, but we won't ask you to make it a full-time job. We are posting a link in the chat. It's a donate button. But once you go to that, press that button, you'll pull up our website. You can navigate to the main screen that has a button that says get involved. That allows you to volunteer. We'd love you to do that. And of course, we'd love you to make a donation. We have set a goal to raise $300 during this program tonight. So if you're able, please look for that link in your chat and you can make a donation at any time during the presentation. We will have some conversation or another conversation after Ming Chen's presentation to talk to you about that one more time and give you some more details. So if you have questions, just hang in there until that point in the program. We will be monitoring the chat to look for questions. After Ming finishes his presentation, we'll have a Q&A session, an opportunity to ask questions. Cello Echeverria, one of our volunteers, will be monitoring that and will be asking those questions for you. And finally, we have, I meant to do that. I don't know if I've done that. Let's look at the screen. But we do have a closed captioning option. And it is right there. So let me open that up. There it is. And so if you want to see the comments that we're making, you can go to that button that says CC on the bottom of your screen, and there's a little arrow next to it, and you can enable that transcription to occur. So the bottom of your screen, there's a button that says CC for closed captioning, and just hit that button. So let's start with the land acknowledgement. I'm participating in this Zoom meeting today from the lands of the Coast Salish people. Please take a minute to acknowledge the place where you are and the peoples and the lands from where you're joining us tonight. We acknowledge all of the ancestral homelands and territories of indigenous peoples who have been here since time immemorial. Our efforts to achieve healthcare for all includes universal coverage for Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Puyallup, Suquamish, Tulalip, and Muckleshoot nations. So tonight's speaker, Ming Chen, is on Washington State's coordinating committee for the Poor People's Campaign. The Poor People's Campaign is a national call for a moral revival. He also sits with many of us on the policy committee of a coalition called Healthcare is a Human Right. So hats off to that coalition for bringing us all together and connecting Ming with programs like ours. I was a public health pharmacist for many, many years and crossed paths with Ming. We worked in several facilities and crossed paths over the years, but it's a real honor to be connecting again. He was retired as a family nurse practitioner from Public Health Seattle and King County. He worked in a variety of settings over the last 26 years, including our detox center, the King County Detox Center, the Addiction Treatment Center in Cedar Hills, and mainly also at the Eastgate Public Health Center. And at that center, he provided primary care to a diverse and a largely immigrant population that comprised at least 37 nationalities, and they spoke a multitude of language. All were low income, uninsured, or underinsured, including many people who were homeless. And together with his team and his patients, he's been navigating these uncertain waters of healthcare reform and helping us take step by step for the implementation of the Affordable Care Act and all the work that our state is moving to become a national leader in providing universal health care. So I'm going to go in and mute everyone again. Please add your questions and comments to the chat. Please watch the chat for for the donation buttons, and also an opportunity to add your questions there. So, Ming, I'm going to ask you to mute, and I'll mute myself.
Okay. Thank you, Ronnie, for that introduction. How's my volume? Or my sound coming out okay? All right, we went through quite some tribulations over the last half hour to get all the bugs out of this. Anyway, thanks for the invitation to be here. Thanks to all of you for joining us. It is nice to be collaborating with Ronnie again after all these years. Our paths first crossed back in the early 90s when Public Health Seattle-King County was still called the Seattle-King County Department of Public Health. Anyway, so I was first contacted by Ronnie about 3 weeks ago, asking about leading a discussion emphasizing the moral values behind our work to expand healthcare access with equity to everyone, and I figured I could handle that. And then I got the first announcement from Healthcare for All Washington announcing the title of this presentation as Healthcare is a Universal Value. And I must admit I was a little taken aback, like, what? I'm not quite sure that I believe that. It's like pretty much everyone wants healthcare for themselves when they need it, but it seems to me there's a pretty sizable segment of our population that couldn't care less about whether anyone besides themselves or their loved ones had access to health care. And then a subsequent email arrived announcing this talk and providing an expanded quotation. Healthcare is a universal value embedded in what individuals yearn for themselves and their families, and what nations require for decent and productive societies. So that made more sense to me, but there was no citation, so I did a little search, and that led me to the article in the JAMA Forum, JAMA being the Journal of the American Medical Association, from December 2017 by Lawrence Gostin, JD, a law professor at Georgetown, and that article was entitled 5 Ethical Values to Guide Health System Reform. And I'll put a link to that in the chat before I go off. In it, he notes that any discussion of reforming the U.S. healthcare system is fraught with political rancor, and he argues that by framing any discussion about health system reform on 5 core ethical values, then alternative visions could be justified by reasoned argument based on which values we prefer and why. And those 5 core ethical values he proposed are universal access, equitable access, affordable access or cost, quality, and choice. Well, that is just a subset of the founding principles of Healthcare as a Human Right Washington, of which Healthcare for All Washington and the Poor People's Campaign are sponsoring organizations. But I'm concerned there is still a sizable proportion of the electorate that is so straitjacketed by ideology that they are incapable of reasoned argument. And you know who I mean. So what if we could talk try to talk about health system reform in terms of morals rather than ethics? Could it be possible to break through hardened ideologies using that kind of language? Well, maybe. What do those words even mean? And before I go any further, I must state I'm neither an ethicist nor a philosopher. All of my professional training is in engineering and healthcare, but it's clear that both ethics and morals relate to right and wrong conduct. Okay? And while sometimes used interchangeably, they are different. So, using my favorite research tool, the index Googleus, I found that ethics usually refer to rules provided by an external source. For example, codes of conduct in workplaces or principles in religions. Morals refer to an individual's own principles regarding right and wrong. Or to put it another way, the website grammarist.com says, the main difference is that morals are more abstract, subjective, and often personal or religion-based, while ethics are more practical, conceived as shared principles governing, promoting fairness in social and business interactions. Oops. Well, we already see some leakage between these terms, as the association with religion just jumped from ethics to morals. But for the sake of argument this evening, let's just consider that morals are guided by some internal compass, while our ethics are guided by... Are we getting an echo there, Ronnie? Okay. Okay. Let's see, where was I? Okay. So morals are guided by some internal compass, while our ethics are guided by an external authority. And I will say that in my searches, I have come across articles that state the complete opposite of what I just said. But we'll just go with the way I'm doing it for now. So that brings me to the Poor People's Campaign, a national call for moral revival, which I am here to represent. The word moral is right there on our name. Can this campaign provide another way to approach this discussion among diverse populations? What is its take on healthcare and how that relates to the overall campaign? And what does this curious term moral revival mean? So let me provide a little history on the Poor People's Campaign and its take on healthcare. Okay, so I'm going to do screen sharing now. Okay. All right, now are you seeing just my slide or are you seeing other garbage around it?
Just the slide.
Okay, perfect. All right. Well, today's Poor People's Campaign, a national call for moral revival, continues the unfinished work of the Reverend Dr. Martin Luther King Jr., who in December 1967 began planning an ambitious direct action campaign, the Poor People's Campaign, expanding the national conversation about civil rights in America by gathering people from around the country and from different races and ethnic backgrounds who shared a common struggle, the problems of poverty. After King's assassination, the Reverend Ralph Abernathy and the other leaders of the Southern Christian Leadership Conference continued to move forward with King's vision, resulting in the first multiracial demonstration in the history of this country to address the interlocking injustices of systemic racism, poverty, and militarism. And remember, this was just over a year after Dr. King first spoke out against the Vietnam War, which made him a lot of enemies. Over the first 3 weeks of May 1968, caravans set out from across the country, including from Seattle, eventually converging on Washington, D.C. in late May, where Resurrection City, which you see on the left of this slide, arose on the National Mall by the reflecting pool. So this was a permitted occupation of National Parks land, its population peaking at about 3,000, and it was even granted its own zip code, 20013. On Juneteenth of that year, over 50,000 people of all races gathered for a Solidarity Day rally at the Lincoln Memorial, right there at the end of the pool, to remember Dr. King's I Have a Dream speech, which he delivered there about 5 years prior. But Resurrection City's permit expired on June 23rd, and the police moved in to evict the 500 remaining residents, arresting nearly 300, including Reverend Abernathy. And sadly, much of the momentum of the movement dissipated after that. So, in 2017, the Reverend Doctors William Barber II and Liz Theo-Harris began the new Poor People's Campaign, a national call for moral revival, taking on the mantle of the original Poor People's Campaign. And we now have 43 active statewide organizing committees, all currently focused on mobilizing poor and low-wealth voters for the 2022 midterm elections. And while the original campaign focused on economic justice, the current campaign also takes on the issue of environmental degradation, recognizing that poor people and Black, Indigenous, and other people of color tend to be the most harmed by environmental injustices and are the least prepared to adapt to deleterious changes due to climate change, like you can't afford to move. And to these four interlocking injustices, or evils as we also refer to them, namely racism, poverty, the war economy, and ecological devastation, a fifth has also been added: the distorted narrative of national morality. So it looks like our audience tonight skews toward my generation, so most of you must remember the moral majority that totally reshaped the political landscape in this country starting in the late 70s. Jerry Falwell and his ilk created an integrated social platform that linked together previously disparate issues such as abortion, divorce, feminism, gay and lesbian rights as they were known then, and the Equal Rights Amendment as attacks on the traditional American family, whatever that was, under the banner of traditional family values. So the moral majority was instrumental in getting Ronald Reagan elected to the presidency in 1980. And although the moral majority was officially dismantled in 1989, mainly due to financial difficulties, we are still having to deal with the consequences of that election to the present day. Witness the overtly Christian nationalist agenda of many, if not most, Republican members of Congress today. Okay, this is a quote from the Poor People's Campaign's national website. And again, I put a link to that in the chat if you'd like to read it to yourself later on. So the new Poor People's Campaign is reclaiming the language of morality from the moral majority, drawing on the wisdom of all the major religions as well as the U.S. Declaration of Independence and the Constitution. And if you look on the National Campaign website, you will find quotations from the Old and New Testaments, the Quran, as well as our national founding documents. And in Reverend Barber's words, quote, all of these traditions basically say that the first goal of faith in the public square and the first goal of public policy should be to care for the poor, the sick, the hurting, the least of these, the immigrant, the undocumented, and those on the margins. And this is a quote from Frederick Douglass in 18 57. The struggle may be a moral one or it may be a physical one, and it may be both moral and physical, but it must be a struggle. Power concedes nothing without the demand. So now, in the third decade of the 21st century, how can we effect change in this country so lawmakers recognize that they need to address the needs of poor and low wealth workers, not just big business or special interests, and not just the middle class, which everyone talks about, but even then, the middle class doesn't get enough and the poor get even less, right? And so the Poor People's Campaign has a research arm, the national campaign does. And in October 2021, they released a landmark report called Waking the Sleeping Giant, Poor and Low-Income Voters in the 2020 Elections. They found that of the 168 million voters who cast a ballot in the 2020 general election, 58 million, or 35% of the voting electorate, were low-income voters. I believe that's considered like less than $50,000 per household. This cuts against common misperceptions that poor and low-income people are apathetic about politics or inconsequential to electoral outcomes.
Ming, I think
Yes.
we lost your video focus. Your PowerPoint.
Weird. Okay, let me stop share and okay. Am I back?
You didn't go anywhere. It was just
Yes, you're full screen.
Okay. All right. Well, let me end the slideshow and see if I can pick it up again. Hello. Okay. Is the sound still okay?
Yes.
Thank you. Okay. Are we back?
yes.
Okay, not too many more slides anyway. Okay, sorry about that. So, among the key findings, in the 2020 elections, low-income voters exceeded 20% of the total population, total voting population in 45 states and the District of Columbia. In the tight battleground states, low-income voters accounted for an even greater share of the voting population, including in states that flipped party outcomes from 2016 to 2020. So we know that mobilizing low-income voters to vote in their own self-interest is going to have a favorable effect. In states where the margin of victory was near or less than 3%, low-income voters accounted for 34 to 45% of the voting population. For Arizona, it was about 40%. Georgia, 38. Michigan, 38. Nevada, 36. North Carolina, 44. Pennsylvania, 34. Wisconsin, 40. So a closer look at the racial demographics of low-income voters in 9 battleground states, I won't list them all here, shows that white low-income voters accounted for a higher vote share than all other racial groupings of low-income voters combined. So this underscores the necessity of organizing low-income white, black, and Hispanic voters together, and other people of color, in multiracial political coalitions. Now, in case you're wondering, in Washington, the population is about 7.6 million, so the percentage of poor and low wealth people, not just voters, but people in our state is close to 35% compared to 42% nationally. So once we have the politicians' ears, what do we want from them? You saw in the first slide the 5 interlocking injustices the Poor People's Campaign is addressing. For each of these injustices, or evils as we sometimes refer to them, we have a list of demands for our lawmakers, which you can see on our website. Here are some of the demands for addressing poverty, and as you can see, the Poor People's Campaign are all in on Medicare for All, or for Medicaid expansion in the interim. But the campaign doesn't begin or end with achieving universal access to health care. As long as the labor of low-wage workers is exploited as it is now, even Medicare for All isn't going to be able to enable many of those workers or their families to enjoy good health. Just as the five evils cannot be decoupled from each other, poverty and health status cannot be decoupled either. People who cannot earn a living wage working one job may have to work 2 or 3 jobs just to survive or to maintain their dignity. They can't afford to live within reasonable commuting distance of their work, so they must spend hours on the road every day. These people are effectively denied the opportunity to take care of their own health, whether it be the ability to make and keep appointments, to medical appointments, to get adequate sleep and exercise, or to have the time and money to follow a healthy diet. Just to put a name and a face on it, I'll tell you about my patient Rodolfo. I'll call him Rodolfo because that was his name, who lives down in South King County. He was 45 when I last saw him, so he must be 48 now. Suffers from depression, high blood pressure, and prediabetes at that time. And I told him the single most effective thing he could do to improve his health, besides taking his meds, would be to start exercising regularly. He told me he really wanted to, but he was working 2 full-time dishwashing jobs. As soon as he got off his day shift job, he had to drive nearly an hour to a second restaurant where he worked the evening shift. Between his 2 jobs, the commute times to and from work, and between jobs, he had 5 hours left in the day to sleep and get ready for the next day. No time for exercise, no time to prepare a healthy meal. But one day he came to see me, and his mood was brighter, noticeably brighter. His blood pressure and blood sugar were much better. I asked him what had happened, and he told me. He quit the second job. He finally had the time to exercise and get a decent amount of sleep. He obviously had less money now for rent or food, but at least he would survive to work another day. So I think I've blabbered on long enough. I would like to give the Reverend Barber the last word. I'm going to share a couple of short video clips with you. These are both from the same speech that he delivered in 2017 before the Health Action Conference, the annual Health Action Conference of Families USA, which is a healthcare consumer advocacy organization, I guess you could call it that. So let's see if we can make this work.
I stopped your sharing.
Okay, great.
It disappeared again.
Did we get to the last slide?
For Reverend Barber.
Okay.
Share screen again.
All right. Hang on. Okay. Here we go. Okay. Did the last slide come across with the quote from Reverend Barber?
Not yet.
Oh, it's not on the screen now, but that was my last slide. Okay. It doesn't matter. I will go ahead and see if we can share the video now. Let's see if this is the right one. Nope, that's not that one. Okay, anyway, these are both from the same speech. This was just before the launch of the new Poor People's Campaign.
But Father, I believe in this moment we need a new language. We need new light or illumination, and we need a new wind. First, we got to get our language right, and we have to learn to speak in new tongues if we're going to reach the masses of people, because we have inherited a language that is too puny for the crisis we face. In fact, it is a trick of the extremists and the empire to force us to use this language because it actually undermines our ability to make a moral call. Somewhere, somehow, many of you, I used to be a victim of it, learn to think of yourselves as a part of the so-called left. Now, who told you you were on the left? That language isn't even of this century. It comes from the French Revolution. Left and right described the political reality that existed then. Those on the left didn't want the monarchy. Those on the right wanted the monarchy. These terms were passed down to us, and we use them over and over again, but they are too puny when you are trying to recover the moral center. The language left versus right, liberal versus conservative, is too small, is too anemic to challenge the extremism that we're facing now. First, why in the world would you call something right and then try to convince people it's wrong? It sounds like you're working against yourself. If you say, I'm against those on the right, that's linguistic trauma, to then try to turn around and say to folk they're wrong. Also, many of you in this room are conservatives. I know you are. I'm sure of it. Because if you really know what conservative means to hold on to the essence of. I know you want to hold on to justice. You want to hold on to love. You want to hold on to mercy. That makes you a conservative. But you're also a liberal because you want to liberally spread it to everybody. We have to reclaim moral language. Only by using moral language can we name this crisis. We've got to learn to speak in tongues if we're going to challenge the lies of this moment. You see, this is no time for a polite conversation about alternative facts or what I like to call alternative lies. See, it's deeper than alternative. I don't even think we should call it alternative facts. These are alternative lies, because when you know there's a video out there with you saying the exact opposite and you still tell the lie, that's an alternative lie. Nobody, most of the time, you try not to tell a lie that you know somebody can click a video up and pull it up and show that you're lying. We need some moral clarity. We have come through a moment, and this is the moment we're in, if I can try to decipher it, when politicians can overtly say and get elected, if you elect me, I'll take your health care. This is how I'm going to make things better. If you elect me, I'll refuse to pay living wages. If you elect me, I'll privatize and resegregate public education. If you elect me, I'll hurt families. This is the agenda I'm running on, and I'll tell you up front I'm going to do it. If you elect me, I'll spread hate against Muslims and against the LGBTQ community. If you elect me, I'll take away a woman's right over her body. If you elect me, I'll treat corporations like people and people like things. If you elect me, I'll give the NRA and its lust for guns unholy power over our governmental processes. And then if you elect me, I'll make it easier to get a gun than it is to vote. And they call that the right? And we participate in it and get votes? No, we must have new tongues. Moral language is what we need now, where we declare some things aren't about left versus right. It's about right versus wrong. It's wrong to take health care from 20 million Americans. It's just wrong. It's not a left or right position. It's wrong knowing that 52 million Americans under 65 have a pre-existing condition, like my daughter that was born with a brain condition and is now just graduated with 2 degrees summa cum laude, but every day walks around with that condition in her head. It's wrong. It's not a matter of left versus right. It's wrong to know that if you remove the Affordable Care Act, 9.5 million women who were previously uninsured now have access to health coverage. It's wrong, just wrong, it's morally wrong to run for office get elected, and because you get elected, you get free health care, and then you don't want the people that elected you to have the same thing you have. That's not about left versus right.
Okay, I got one more short one, just a little bit later on in the same speech.
And so we got to have a new language. Touch your neighbor and say new language. A language that says protecting and expanding voting rights and ending voter suppression and unconstitutional gerrymandering and protecting equal protection under the law for all people regardless of their race, their creed, their color, their sexuality. That's not a left issue, that's a moral issue. Pro-labor, anti-poverty, anti-racist policies that build up economic democracy through full employment, living wages, alleviation of disparate unemployment, a transition away from just transition away from fossil fuels, labor rights, affordable housing, direct cash transfers, and other supports for families struggling to get by, and fair and just immigration policies, and critiquing the policies around warmongering that undermine our moral standing and ability to address domestic issues. Those are not left issues or right issues, those are moral issues. Equality in education by ensuring that every child receives a high-quality, well-funded, constitutional, diverse public education and access to community college. That's not a Bernie agenda or a Clinton agenda. That's a moral agenda. Health care for all, beginning with saving the Affordable Care Act, but not stopping there, giving us universal health care and environmental protection and dealing with climate change. And protecting a woman's right to her own health. That's not a left issue, that's a moral issue.
Well, thank you, Reverend Barber, and thank you all for indulging me. I think that is the end of my official presentation, and I believe we are up for Q&A or other discussion.
Wow. All I can say is wow. That was really some important issues. Talking about moral values is easy to put in the back of our mind, but it's so important to use the right language to begin to talk to people. One of our healthcare allies who has an annual lobby day, the Faith Action Network, really came out to nudge members to, when we go and talk about a particular issue, to say that the budget is a moral document. Just bringing the words out made such a difference. We could see it on legislators' faces. So I've had the opportunity to be involved with groups that are doing that. I think it's so important to share those words from Reverend Barber. And I think it's important, for the words that you've shared with us tonight, Ming, to talk about patient interactions, to talk about your involvement with this movement. So thank you very much. So we are asking you to put questions into the chat, and the chat also has a little donate button that that Cello is adding into our chat. So go there to look for that donate button, which can take you into our website to volunteer in our get involved icon, or to make a donation along the way as you are able. And talking about donations, let's switch from Ming and I to bring one of our board members, Peter Lucas, up to walk you through the easiest way to make that donation. So, Peter, unmute.
Okay, can you all hear me?
Yes.
So, yeah, that was a great presentation, Ming, and you just can't go wrong by putting up a video of Reverend Barber. He's so incredible. Our group, Healthcare for All Washington, we've chalked up many legislative victories in Olympia, including helping to establish and appoint members to the Universal Health Care Commission. This group could craft a publicly financed universal system based on our bill, the Washington Health Security Trust. But in order to maintain our momentum, it is vitally important that we grow our membership, educate the public, and mobilize our supporters to spread the word to their family, friends, and most importantly, their legislators. And we can achieve these goals through social media, monthly webinars such as tonight's excellent presentation, meetings with civic groups, and by hosting other events. And lately, we've been getting out more from behind our laptops and smartphones and meeting with people in person. That's been a nice change recently. Hopefully, we'll be able to continue to do that. In addition, we are pleased to have a new, experienced, and dynamic lobbyist. We have a communications specialist, and we have other fixed costs. And these activities and obligations all require funds, which is why we are asking you to donate tonight. So our goal tonight, as Ronnie stated at the outset, is $300. Please go to the links that have been copiously posted in the chat, or go to our website and click on the donate button. You can make a one-time donation, but we're really encouraging people to make recurring monthly donations. That really helps provide stable support. So please donate so we can spread the word and bring about universal, publicly financed healthcare in Washington. And that's a moral imperative. Thank you.
Thank you, Peter, for sharing that message. And now we'll bring up Cello, or Consuelo Echeverria, and bring Ming back into the picture. And we'll ask a few questions.
Please do ask questions in the post. And while people are putting their questions together, I would like to start with one from Elise. I hope I'm not slaughtering your last name. De Goya, I don't know, maybe. She says, thank you, Ming. I would love to hear any other stories from your decades of practice that illustrate the urgency of what is most needed at this moment. Is it stopping the privatization of Medicare? What do you see most urgent in the year ahead for healthcare?
Oh gosh, that's a hard one. I don't know how I could possibly identify one issue as the most critical. And remember, I've been also retired for a couple of years now, so I'm not on the front lines anymore. Yeah, definitely privatization of Medicare is a menace. But you know, since we don't have Medicare for all yet, it means there's other issues that we need to deal with at the same time. I think probably, well, it's hard to say what's most critical, but it just seems like, I guess the one thing that could have the most immediate impact on the most people right now, as I see it, is expanding Medicaid in all the states that have not done so yet. I did a presentation for the Fellowship of Reconciliation back about, well, right after the Affordable Care Act was passed, and I was comparing health data from I think it was Holmes County, Mississippi to King County, and it was, you know, Mississippi was one of those states that has not expanded Medicaid, at least at that point. I kind of doubt that they have yet either. But the disparities were just so stark. And at that time, the two nurse practitioners who were delivering 25% of the primary care in that county, literally 25%, two women delivering 25% of primary care in that county, they had just been murdered in their own home. So yeah, I guess I would really like to see, you know, because it's going to take some time to get to Medicare for all or single payer, let's see at least Medicaid expansion happen, because that can help a lot of people really quickly. And Karen, my wife Karen, just reminded me of this. Yes, Mississippi still has not expanded Medicaid.
I mean, would you like to, you don't get the account?
I'm sorry, what was that?
You mind muting so we don't get the echo?
Okay.
Thank you. Here's everybody else. I'm assuming can hear me. Thumbs up. Okay, perfect. As a follow-on, Kathy Sharp asked, "What exactly is the privatization of Medicare? Can you explain what its risks are?"
Well, I guess in the simplest terms, privatizing anything means that money goes into the pockets of capitalists. You know, as soon as Medicare becomes, at least the basic Medicare becomes something that's administered by private corporations, they're going to figure out a way to get money out of it, and so all that money is going to be going to pay, you know, the CEOs and their boards rather than going to help pay for our health care. So, yeah, but there's a concerted effort on the part of the Republicans in Congress to make privatization happen, and you know, healthcare for all and healthcare as a human right are all working to stop that, at least on our level.
While we're there, can somebody please just put in the link to Pusara's excellent page explaining what ACO reach is? Just because I'm reading other questions. Okay, our one and only Ronnie Shure asks, "In the world's richest nation, is it too much to ask that everyone take a fair share of the financial burden so that everyone receives care at the time they need it the most? Healthcare is a universal value embedded in what individuals yearn for themselves and their families, and what nations require for decent and productive societies, like insurance companies, hospitals, and pharmaceutical manufacturers." And he asks, in all serious, is it too much to ask?
Well, I certainly believe in everyone paying their fair share. Yeah, I don't know how else to respond to that. I did see that Dr. Weinberg had a comment earlier that we didn't address, mentioning that in the current New England Journal of Medicine is an article about physicians' professional obligation to do what's needed for their patients, even if the government passes laws to interfere. And the article speculates that civil disobedience may be required of physicians, and of course that would apply to other healthcare providers as well. And I can certainly see that is very close to happening. Well, I think it actually has happened somewhere in the Midwest recently. I mean, in this case, civil disobedience doesn't mean sitting on a senator's office floor and getting arrested. It means providing a needed service to someone who the law says you're not allowed to give that service to. So, yeah, it's going to take some courage.
And I think, Ming, we could certainly close with saying that you and I have spent our time in jail, King County Jail, specifically working for the public health department, but have seen the fact that you know, people do need to stand up. We're fortunate to be in a state that where even our legislators are listening to messages about universal health care, about moral values, and we are moving forward. It's frustrating that we have worked so long to make this happen, and it's at the same time really feels positive that we are moving forward. Things are happening. So if you can put the spotlight back on me.
Hang on one second. I would like to ask a question, if I may. Do we have time for one more quick question?
Sure.
So in your presentation, you noted, Ming, that white voters, poor white rural voters, had a somewhat of an impact on election results. I'm curious to hear strategies in Washington State. What strategies have been utilized to try and bring in poor white rural voters in Washington State?
Well, the effort, at least on for the Poor People's Campaign as a national entity, most of the energy is being poured into the states where the larger part of the vote of the actual voting electorate in previous elections has basically voted against the interests of poor people, even though a lot of them were poor. So, here in Washington, we're relatively, well, we are very fortunate to have people like Senator Murray and Pramila Jayapal, representing us. So, and even then, two of our Republican representatives in Congress at least had the courage to stand up to Trump, at least when things really came down to push to shove. But the get out the vote effort is basically getting out there and talking to people, registering people to vote, and making sure they figuring out how to help them get around all the new obstructions to voting that state legislatures have been passing all over the country. So there's no one strategy, but it's all about educating voters, educating poor and low-income voters, and making sure that any of them that are eligible to vote do get to vote. So it's hard to be more specific than that. Someone also mentioned that when we were talking about privatizing healthcare, they wondered if I'm not sure how they meant to direct the question, but they're basically saying, what about Medicare Advantage? And that's a good point. I'm actually on a Medicare Advantage plan myself, so those plans are in part administered by private corporations, but they provide extra benefits beyond what basic Medicare does. So it's kind of a separate issue. But right now, we want to focus on saving basic Medicare and then expanding it.
I'd like to say something to you. Is that my voice? I can. It's like in a hollow. I'm on a Medicare Advantage also, but that's only because I know I can switch to traditional Medicare when I get really sick and older and sicker, because I know the Medicare Advantage doesn't want me anymore and will start putting all kinds of delays and denials. However, now with the ACO REACH program, traditional Medicare is going away by 2030. It's already started. It starts January 1st to take it away from us and privatize. That's already the law. It's not the future. It's not what Republicans might do.
And I think so, Anne, I think you're raising a really important point about these hidden, non-transparent programs that are interfering with traditional Medicare, but there still is an opportunity to make a difference. And with orders like ACO REACH, which are departmental or executive orders, really on a CMS, on a departmental level, we have opportunity to intervene and to let our legislators know that they should be intervening. So that's a really valuable point. So thank you for adding that important message. And it's almost 8 o'clock. Let me thank you, men, for taking the time to look and stop and wake us up to these values, putting the language in front of us really can make a difference. I have seen it myself, so I'm glad you shared Reverend Barber's words, and I'm glad you shared your words. So thanks for tonight. And you've seen volunteers like Peter and Cello who have stepped up in front of the screen. Thank you, Peter. Thank you, Cello. And also people behind the scenes, Rich Legou, who has been admitting people, and Ron Lovell, who has been spotlighting us and bringing us in and out and making things go so smoothly for tonight. So thank you to them, and thank you especially to you, each of you, for joining us and to looking at these values that we really can stand on when we talk about expanding healthcare to everybody. So thank you and good night.